Hi, and thanks for joining our TMC Live session for health and social care. I'll shortly pass you over to Alison, Matt and Sally, who are part of the Health and Social Care Department here at the Manchester College. Tonight, they're going to be providing you with a showcase of our range of health and social care courses. If you've got any questions at all throughout the session this evening, please pop them in the Q&A box on your screen. So it's on the right of your screen, and we'll answer as many questions as we can at the very end of the session once Sally, Matt and Alison have finished speaking. So with that all said, I'll now pass you over to Alison, who will get the session started. Over to you, Alison.
Thank you very much. Hello, everybody. Welcome to the Health and Social Care Department. My name is Alison Dady and I'm the Head of Department. And I'd like to welcome you to our virtual open event this evening. And I hope that you find all the information that we provide really useful and helpful. You're also going to meet Matt Mason-Smith and Sally Cooper, who are two of our department team leaders. So we hope you enjoy our presentation and really hope that you decide to come and join us at the Manchester College. Thank you. Over to Matt.
So welcome to the Health and Social Care presentation. We are a department that's for 16 to 18-year-olds, and we are based at the Nichols campus, the Openshaw campus, Harperhay and Northern campus. So there's a wide range of sites that you can access your learning for your courses. So we'll just show you a quick video.
Hi, I'm Amber. I'm studying Health and Social Care Level 3 at Manchester College. I chose this course because I looked around at different colleges and I decided that this was the best one to come to, as I did my research and everyone said it was the best one. I enjoyed learning new things on Level 2, as I didn't do it in school. So it was a learning curve and learning new things, and Level 3 is teaching me how to progress onto what I want to be when I'm older. Studying online has been a bit strange, but I like being in sometimes as it's like normality, bringing normality back. But then online it gives you a bit of independence to do your work yourself and learn how to do it. The college are teaching you what employers want you to do in the workplace, so what you expect when you go to work, and they're teaching you like how to write a CV, how to make it better, and what to do and what not to do. I'm hoping to progress onto the second year of Level 3, and then after college hoping to progress onto uni, and then onto then be a midwife. I want to become a midwife because I like the idea of bringing a new life into the world and supporting new mums. I would recommend the Manchester College, as the teachers here are very helpful and the college is really helpful to help you understand what you want to do in later life and help you choose that career path. Hi, I'm Amber.
So there's an endorsement from one of our learners up at Harperhay who has discussed what she gets from being a student on the course. In terms of achieving your potential, we really want you to know that we are looking at your future career and not just a course for you to study. And as part of that, we have the Industry Excellent Academy, and that means that you will benefit from a course that's developed and delivered with employer engagement, and this can be at Level 2 or Level 3. You'll have a placement with an industry employer, so some of our employers will provide that placement for you, and it will be a minimum of 15 days. Okay, the sessions will also have industry experts teaching you and delivering with our tutors, and you'll have visits from guest speakers at the forefront of their sector. And this will ensure that you can develop those skills that you can take into your future career and your future studies. In our Centres of Excellence, we have a range of courses that range from entry level right up to Level 3, and this can be the full extended diplomas. If you haven't achieved your grade 4 in maths or English, you'll also be required to study alongside your course, making sure that you've got those essential skills for further study and employment. Alongside your work experience, you'll also do a range of hours and days, and you'll learn vital skills that will help you in line with your level of study. And alongside that, we also have employability sessions that will help you with those skills that you can take into your work placement, into your future workplace and beyond to help you thrive. Coming into the next academic year, we'll also have technical levels, or T levels as they're being branded. And this is technical alternative to A level, so these are at level 3, and within that you will be studying a 45-day industry placement, and that'll be out there in the workplace. It will give you a chance to gain wider knowledge, so not just the knowledge of the topic but also the skills that are needed in a certain sector, and these are developed in line with industry standards. So this will be an opportunity for you once you've completed your GCSE studies, and it might be something that you're interested in joining our Industry Excellent Academy in the next September. And if you find that more interesting, then please do click on the link that's available on that site. So now we're going to give you an introduction to the health and social care courses that we currently have on offer at the college.
Hi, I'm Majida. I'm one of the tutors at the Harper Hay campus. I teach health and social care. We're going to give you a tour of some of our facilities. Some of the facilities we have at the campus are things like the hospital bed, the wheelchair, the x-ray machine. The students really benefit from this as they can use this equipment for role play, and it also gives them an insight as to what equipment is available within any health and social care environment.
Hi, I'm Matt. I'm the department team leader for health and social care here at Northenden and at Openshaw. Today I'd like to show you around the practical space we have at Northenden and some of the equipment that you'll be using. In our practical space, you'll be able to use our high quality equipment through simulated role plays and simulated working environments that will help you develop your skills such as manual handling and caring for service users that you can take directly into the workplace and your work placement. You'll also be doing practical assessments on serving and preparing healthy drinks and snacks for service users using our kitchen equipment and our assisted cutlery and crockery. As a health and social care student, you'll also have the opportunity to complete a one-day first aid in the workplace course. This will give you essential life-saving skills such as resuscitation and CPR, use of the AED, choking, and other basic first aid requirements that you can take into your workplace. So you've just had a brief tour of the practical space we have at Northenden that will give you skills to enhance your curriculum and your work experience. We look forward to seeing your application. Hopefully see you soon. Thank you.
Thank you, Matt. That was a really insightful view on two of our campuses from myself and Majida. We're going on to some of our employer partners at the moment. These are some of our placement settings that are not just limited to these settings, but are willing to endorse our programme of study, and they will be part of our study programme for our level 2 students up to level 3, year 1 and 2. Another video for you. Thank you.
Hello, my name is Lucy Brett and I'm a work placement officer for level 3 health and social care at Northenden and Openshaw campuses. I'm responsible for setting up work placements for learners. In order to do this, I engage frequently with a number of employers on a regular basis to ensure that there are a variety of opportunities for our learners. I also spend time with the learners to find out what they know about the different placements and to ensure that they know what is expected from them whilst they are on placement, and also to find out what placements they would like to undertake. Once learners are in placement, I will continue to liaise with both learners and employers to make sure that they are fully supported within their placements. I will also conduct placement visits, and I will undertake observations and assessments of the learners and gain feedback on the learners' performance from the employers. Learners are placed within a variety of different health and social care settings, such as hospitals, We have a strong partnership with Manchester University NHS Foundation Trust, which covers 7 hospitals within the Manchester area, including the MRI, St Mary's, the Manchester Children's Hospital and Wythenshawe. We also have a good partnership with the Christie. Students can also be placed in care homes, special education needs schools, health centres, children's centres, physiotherapists, youth clubs and pharmacy. Learners will be expected to complete 200 hours over the 2-year duration of their course within their placement. We also offer our industry placements that require learners to do 315 hours. Both types of placements will equip the learners with the knowledge and skills required to either go on to higher education or onto employment. And we always have a number of students each year that will gain employment within their placement settings. As already mentioned, some students will gain employment opportunities within their placement settings, which always makes the college an ideal path. It is also really rewarding when you go on placement visits and the supervisor gives good comments on how the student is progressing within their placement. I have had great feedback off supervisors for students who may lack in confidence in the classroom, but they are showing great confidence within their placement.
Thank you. Matt. Okay, sorry about that little technical hitch there. So what will you be studying on your health and social care? Well, we have a variety of courses starting from our entry level 3, and it covers a variant of subjects, and these subjects will carry on all the way and feed through each level of your learning, building on those skills that you'll develop as you go, from skills of learning, team challenges, supporting individuals, health and well-being for the workplace, and communicating with people, which one is an essential skill in health and social care. You could then even go, you could progress then if you have the skills to go on to level 1, and we do an introduction to health and social care. And again, these building on the skills from entry level 1 with your requirements of entry. With entry level, you don't need to have any qualifications, but level 1 you need to have grades in your GCSEs to achieve a level to apply for level 1. Okay, there are various study skills that are embedded in this. You will study your English and maths alongside your curriculum study programme. We then move on to level 2, extended certificate in health and social care. It also includes a transition level onto T levels. These subjects are not exclusive, so there are a variety, and we do sometimes change the courses and the units that we cover based on what the industries are requiring. On level 2 there are 2 exams. These are sat in January and again in May should you need to retake those exams. On our level 3, we have 2 different courses on level 3. So we have a level 3 RQF extended diploma, which is a 2-year course. This is a highly academic course and also has exams running through it. 2 in the first year and 2 in the second year. We also run alongside a long unit that embeds with all the study programme. Placement is required on level 3, and you'll be doing 200 hours over the 2-year period at level 3 on the RQF. Our level 3 cash extended diploma is also a 2-year course. There are no exams on this course, however there is a synoptic test paper in the first year and one at the end of the second year. Again, these subjects all interlink with each other and are very specific to health and social care sectors. New to us from September is our level 3 T levels, which Matt touched on earlier. These are, we're doing a health and science route, and it's a 2-year programme. These level 3 technical qualifications will provide learners with the knowledge, skills and behaviours needed to progress onto skilled employment or higher technical training in the health and science sector. Again, we expect at this level for you to have GCSEs at a grade 5 or above in English, Maths and Science. Also, there are placement hours attached to this, again, for around 200 hours to 315 hours. The content for the level 3 T levels will cover the following areas. So the core working with health and social care sector, health in general, safety and environmental regulations in health and science sector, managing information and data within the health and sector, which is extremely important with our data protection and GDPR, of how to keep people's information safe and secure and confidential on a needs to know basis. Those are just some of the subjects we'll be touching on. And now I'm going to show you a short video from one of the tutors.
Hello and welcome to the Manchester College Health and Social Care Department. My name is Dav and I'm one of the tutors at Nichols campus in Ardwick. Have you ever wondered why some people are left-handed but most are right? Have you ever wondered how your brain controls your heart rate or why this is so important to life? We explore questions like these on our courses. I teach from entry level through to level 3. I'm also one of the leads for the brand new T levels in health and healthcare science that we will be providing from September 2021. There will be a transition to T levels this September at level 2 for those of you interested in a technical qualification to boost your future employment chances. My specialism is caring for children and young people, behaviour management and the psychology behind building professional, supportive relationships with service users. I have worked in care homes and residential schools for children and young people with learning difficulties and specific behavioural needs. You can expect to learn from me how the principal perspectives of psychology and many other subjects can be applied across different sectors of the industry to offer you a solid foundation in developing your own professional voice, supported by theoretical knowledge, underpinned by legislation, to give you the confidence to work in this vast sector in an area that you really enjoy. Every level 2 and level 3 learner will be supported in some form of work experience placement, ranging from 30 to 315 hours, depending on the qualification. This year, I have placed learners at the MRI, supporting nurses and midwives on hospital wards, in cardiac specialist units, care homes and many social care charities. My learners have progressed to university on courses such as nursing and social work. I was very proud to have recently bumped into one of my past learners at the MRI, who is currently a student nurse there. Interested? Then apply now.
Now I'm handing back over to Matt.
Thanks, Sally, and thank you to Dal for that informative video. So why choose health and social care? So health and social care is a wide-ranging subject choice to take at the Manchester College. And as we've seen, particularly during the lockdown period, that the NHS and care sector has never been in such high demand. So jobs in the area also give people a sense of pride and a sense of purpose within their job. And between 2016 and 2020, they're predicted to be 10,000 to 14,500 annual openings for those jobs, meaning these will be new positions or the replacing of staff as they sort of retire. So the average salaries could be up to £29,000 per year. So obviously it is a rewarding job and also has a good pay salary associated with it. So why choose health and social care? Well, at the moment we are having a brand new campus redevelopment, as we discussed earlier about our centres of excellence, and this will have brand new cutting edge facilities building on our existing facilities. Also, our Industry Excellence Academy for Health and Social Care will allow us to build and foster further industry partnerships that will give you lots of opportunities in health and social care sectors. You'll have employability sessions and an employability tutor who will help you with that, alongside our work placement officers who will help find those placements for you. Also, we have the employability and partnership coordinators within the department who will help you every step of the way, regardless of what level course you're on. So what jobs could it lead to? So it could be social services manager or director, it could be a health professional, occupational therapist, healthcare practitioner, as well as jobs such as ambulance staff, nurses, midwives, social workers, care workers, or nursing assistants. Dependent on the level of the course, that will allow you to develop the skills, qualities and academic qualifications to allow those jobs for you. But there are also a wide breadth of the allied occupations that you could apply for. So what are your progression routes? Now, you will engage in the health and social care course dependent on your GCSE results. That will determine which level that you end up on, rather than whether that be entry level if you have no formal GCSEs, up to level 3 T level where you will have predominantly 5s in your GCSEs, and you can move throughout the levels. On successful completion of an entry level, you could move to level 1, level 1 to level 2, level 2 to level 3 or T levels. Following on from your study with us in the 16 to 18 provision, you could be enabled to access our HNCs or HNDs, and that could be through our partner UCAS Manchester, or it could be onto other universities where you may study nursing or social work degrees, just to name a couple. It could be that you go into direct employment. We have a number of learners who finish their studies with us and go directly into health and social care related fields. Or it could be that you do further work-based learning, such as apprenticeships within health and social care. So thank you for taking the time, and I believe we'll hand over now and answer any questions that you may have.
Fantastic. Thanks, Sally and Matt. That's great. So we've had quite a few different questions through. The first one I'll start with is quite a common question we get asked, actually, and it's maybe slightly different this year. But how many days will I typically be in college? And I suppose it'd be maybe useful if you can talk about this year, and then also maybe what you'd maybe class as a normal year, I suppose.
Yeah, so I'm happy to take that question. So in terms of your current study programme, we do have a 50% of face-to-face learning taking place at the moment, and obviously we are under safe social distancing and our very good risk assessments and that's taken place. But generally speaking, that students are in study for roughly 3 days a week, and dependent on level 3, that could be a 4th day, which includes placements. Now, your timetable will vary dependent on your own needs. So if you do have, say, a need for maths and English, obviously that's going to be in addition to your vocational studies. But currently we are doing a mix of face-to-face and online learning. So that's virtual learning through Microsoft Teams. And also you'll be streamed into other live classroom settings as well through that. In a normal year, when we're not under the COVID guidelines, then you would be expecting to be in 3 to 4 days a week.
Okay, fantastic. That's great. Thank you very much. The next question is, what would I be expected to do when I'm on a work placement? Obviously, a lot of our courses do involve that work experience. So, what would students be getting involved in on those work placements?
So I'm happy to take that one, Christian. Well, on your placement, it depends actually where you are on your placement. If you're in a care home, there are obviously certain situations that you can't take part in, but we expect you to take a full and active part in all the day-to-day care for patients, residents at care homes, engaging in conversation, doing activities with our service users. You know, it's really important to actually do the job when you're on placement and have that experience that you want. We don't expect you to be changing nappies, changing incontinence pads, handling any body fluids. Those are for the professional care staff to do. So although you may feel that you're quite limited in that, until you progress and you get further down your career, that's when you'll be doing all the, you know, nuts and bolts of the job, but you're learning those skills, and by peer assessment and watching those people do their day-to-day activities really is important for you to develop as an individual. You'll be expected to do activities and write reflective notes on your placement of what you've actually done and how you felt about that, and so it's building those skills to develop you as an individual. So, you know, even making a cup of tea could be the most important thing you've done for one person in the day, and sitting down and having a chat with that person. Shadowing nurses is a really good placement to do, but most of our level 3 year 2 students build on those skills as they're getting towards the end of their second year and go into hospitals as placements.
Okay, fantastic. Another question on placements then. You showed a list of some of our employers that we work with earlier on. We've had a question in that, are these the only placement settings that we can go to, or are there more that we can do? Can we arrange our own, I suppose?
I'll have to take that question, yeah. So in terms of your work placement, you do have the opportunity to choose your own work placement. However, what we must ensure is that the placement is suitable, that it's risk assessed, that there's no conflict of interest. So for instance, if it was a care home that a family member was at, we would encourage the learners to choose another care home that they met working, because that will ensure that they can have an objective view and learn their skills in an environment that's fairly neutral. If it was a case of a learner wanted to go into a certain placement working with young people as opposed to working with the elderly, we have the work placement officer who can help find those placements for them. So a learner can choose different work placements, and that would go through the work placement officer, who will assess the work placement. Is it a suitable environment? Does it meet the high standards that we expect from a placement? And also, is it a suitable environment for a learner to be safe and learn effectively on that placement? So learners can be encouraged to find their own placement. We're not going to put a learner in a placement where they're not going to benefit for their own future careers. So we find it's really important that we do have a vast bank of work placements, but as I say, we're always looking to expand our portfolio of placement providers. And if that's from a learner who's found their own placement, as long as it's suitable, that's fine.
That's great, thank you. So the next question is again on a similar work experience route. Will we get to go to hospitals and see how nurses and midwives work?
I'm happy to answer that one. At the moment, unfortunately, due to the COVID restrictions, we are quite limited in being able to access any hospital environments. As you can all appreciate, it's a really high risk area at the moment with those with the COVID procedures in place. So, but we do develop our students to be able to go out, and we are liaising with hospitals, other trusts, to be able to get our students to go out and maybe just shadow a nurse. Dav talked a little bit about that in his presentation. He has really good links with Manchester Foundation Trust, and at the moment he's building on those links to see how many students we can get into the workplace.
Okay, fantastic. Another question, again, you did answer it in the presentation, but maybe just a quick summary in terms of what grades would students be expected to be able to take some of the courses, you know, what in terms of different entry points, I suppose. Yeah,
I can take that question. So in terms of the grades that you need, that depends on what your GCSE or prior attainment is. So the entry requirements for the entry level 3 course is no formal qualification. So if you do not achieve formal qualifications at GCSE level, so we're sort of talking U's, then that's the course level that you'd start at. Obviously, moving up to level 1, that would be a range of sort of 2s at GCSE, and level 2 would be predominantly grade 3s and 4s. Level 3 itself would be 5 grade 4s or above, including maths and or English. And then for the new T level, level 3, we'd be expecting 5s in that, including maths, English and science. So in terms of the qualifications, once you have started your programme of study, you have the opportunity to move through the levels at the end of each academic year. So you'd complete your entry 3 and you can move on to level 1. Likewise, completing a level 2 would then open up the opportunity for you to progress to level 3. So that entirely depends on the qualifications that you possess at the end of year 11. In terms of any international qualifications that people may have studied, we have them run through what we call the NARIC system, and that would give an equivalence of what level that you would be at. So those are the entry requirements.
Well, okay, and there's a question from someone, and again, you've just mentioned it there really, but if you don't get the grades, can you not participate? Obviously, based on what you've said there, we do have options available for anyone that's not got the grades.
Yeah, so in terms
yeah, can I just pick up on that one, Christian? We pride ourselves at the Manchester College and in our department on having a course for every level. So no matter what you do come out with in terms of your qualifications or your prior achievement, there is a course for you at the college, and we'll discuss all that with you once you put in your application and then through the enrolment process. So please don't be put off. If you don't, you're not happy with the results that you do get, come and talk to us and we'll find a course suitable for you.
Brilliant. Thanks, Alison. The next question, we've had 2 questions actually through regarding apprenticeships. Now, obviously, we don't offer apprenticeships through the Manchester College. We do have a partner organisation called Total People that does that. However, from your perspective, obviously, we do have the T-level course coming up, which is sort of within that region, I guess. Can you speak a bit about that?
Yeah, sorry, Christian. Yes, that's not a problem. Yeah, the T levels, because the amount of placement attached to the T levels, it does border on an apprenticeship sort of route as well. So, we would advise for our students, if they've got the qualifications at a grade 5 or above, to apply for the T levels, because that does give you a far more employer engagement part of your study programme. It's a huge part of it, so it's bordering on 50-50%. So the government are asking us to promote T levels as much as possible, because there is that academic side and the work related side, which runs as like an apprenticeship.
Yeah, fantastic. And we've had a question that's similar, following on that line. If you choose T levels, does that mean you'd be able to progress onto a job after the 2 years, or would you think you'd have to go to university first as well as after studying a T level?
No, by all means, you can get a job. That's not a problem. Most health and social care organisations are asking for at least a level 2. They do prefer a level 3 in most health and social care sectors. And yes, you can apply for employability. There's no expectation that that's a learner choice, whether that learner wants to progress onto university. We obviously encourage our learners to go further with their education and build on further skills. But a lot of learners choose after the 2nd year that they want to go into employment, and we will help and support them with that.
Brilliant. And on the flip side of that, we've had a question through about UCAS points attached to some of these courses. Could you give a bit of information on that?
Yeah, we can give some information on that. So in terms of the UCAS points, now that all depends on what grade that you achieve. Now, UCAS points are only attached to our level 3 programmes. So those of you who are thinking of an alternative to A levels, the level 3 courses are the equivalent of A levels, and they're a different way of learning, and you might get quite a large depth of information into health and social care. The higher the grade that you get, the more UCAS points you get. And obviously, if you're looking at going into, say, a social work degree, or you want to be a social worker, or you're looking to be a midwife or a nurse, the courses that we offer at level 3 give that opportunity to move on to university. Also, we have our tutors who are really focused on ensuring that the learners are supported in their UCAS application, which our current tutors are working on at the moment, to ensure that the right course at university is found at the right university, and the staff will support the learners in ensuring that they know how they can get the grades to ensure that they're able to progress to university.
Fantastic, thanks Matt, and you've just answered two other questions we had there as well. So we had two questions saying, can I be a social worker with this course, and can I be a midwife with this course? The answer there sounds like it's an absolutely yes, so thanks for that, Matt. The next question we have is maybe someone that doesn't perhaps know exactly how sort of further education and colleges work in terms of number of courses you study, and maybe the question is, how many courses do I have to do? So could you talk about that? It's quite a simple answer, I think.
In terms of if the question's regarding to say your GCSE options where you've taken a number of subjects, in FE we choose a study programme. So sorry, the light's just gone out in my room. I'm back. So in terms of your options, you would just choose health and social care as your course. So that would be the topic that you do, and that would be what we call our study programme. So you would be doing one subject, so to speak, but in that subject, as we said in the presentation, there's lots of different units which are the topics that you'll study alongside that course. In terms of how many courses you do, if you get the entry requirements for level 3, you would just slot into the level 3 programme, which will be 2 years, and then after that course you would decide after the 2 years whether to go to university or into employment. If it's level 2, you could do level 2 and then you could go into employment or choose a different pathway, or you could move on to the level 3, which will then enable you to do that. So that would be 3 years, so you do 2 courses.
That's great, and again, you've done it again, Matt. You've answered another question that we've had. So that was about if I get 5 or more GCSEs, do I just start straight on the level 3 course? So
yeah,
right. Fantastic. Okay. The next question is about campuses. So, which campuses can they study health and social care at? And one question: would you recommend Openshaw? So.
I would recommend Openshaw. I do manage that site, so I'd definitely recommend Openshaw. And also, that just to let you know that Openshaw will be the site of our Centre of Excellence moving into the future. In terms of campuses, that's down to the choice of the learner. So you do have choice of which campus you want to go to. We have provision in the south, which is Northern campus, provision in the north of the city, which is Harper Hay, and then quite centrally we've got the Nichols campus and the Openshaw campus. In terms of that, I suppose the answer is whichever campus that you'd be happier going to, or maybe which one's easier for you to get to in terms of travelling and how you're going to get there. But all the courses are the same.
Lovely, great. So last couple of questions. So the next one is, what grades do you need to learn to be a psychiatrist? Is that something that's covered within sort of health and social care courses?
Yes, it is. We do a psychology course, and you can progress onto university to go on to do a psychology course as well to get your degree. So it depends on your GCSE results mainly. You do need to concentrate on your English and maths. I know most learners will go, I hate English or I hate maths, but those are really key subjects to have, because that will only enhance your progression into jobs like being a psychologist, a psychiatrist, a criminologist. We have all those provisions to be able to go into. And it depends on the learner now. It depends on you. You need to do what you can do to achieve your goals.
Fantastic, lovely. And the last question we've got here is, when do applications have to be made?
The sooner the better.
Yeah, I agree.
The sooner the better. The sooner you apply, the sooner you can have that interview, whether it be on the phone or on a Teams meeting. That's great, but the sooner you apply, the better for you.
Lovely. Well, thank you, Alison, Matt and Sally. That's all of our questions for this evening. I think that's been really useful. We've had some really good questions from everyone, so thank you all for submitting your questions as well and for joining us this evening. We do have some more TMC live events running until Thursday, So if you're interested in the other subject areas, or you want to know more about the Manchester College, then please do visit tmc.ac.uk/TMC Live, and you can register for some of those other sessions. As we've just mentioned there, if you would like to apply for a place at the Manchester College for 2021, then please visit the website tmc.ac.uk. As the #1 college in Greater Manchester, we are expecting a lot of applications. So as Sally's just mentioned there, we would recommend getting your application in as soon as possible, and then we can start getting you invited in for interviews and that kind of thing. If you do need to speak to anyone about applying, or you'd like a bit more information, our school liaison team are available this evening until 8 o'clock, and you can call them on 0161 674 3496. We do also have some places still available for this year. It's not too late to enrol, so if you'd like to do that, then our admin team are available to help you enrol and give you further information. You can give them a call on 0161 674 1080. And then lastly, for learners with special educational needs and disabilities, we do have a transition team who are available to make the move from school to college a positive experience for you. So you can contact them by emailing transitionteam@tmc.ac.uk, and I believe this information should be available in the chat box now, so you can pick up all that information in the application details there as well. So that's everything for this evening. We thank you very much for joining us, and we hope you have a lovely evening. Thank you.
Thank you.
Thank you.